So this is the healing abutment of the implant on the lower left second bicuspid. There's the implant. That's osseointegrated for 3 months, and now it's been about another 3 weeks since I impressed it, waiting for the implant abutment and crown to come back from the lab. So a total of about 4 months for the bone to osseointegrate with the implant. Now, to my knowledge, I've never lost, I'm going to knock on wood, a root form implant, but I never load them at the time I place them. I always let them osseointegrate for 3 months before I take the impression, so by the time I seat the abutment and crown, it's about 4 months. Now, that record could be broken next week, but I've done lots and lots of implants, and to my knowledge, I've never lost an implant abutment and crown because they're so well integrated, osseointegrated with the bone. To me, it's like a fence post, a metal fence post in concrete. If you wiggle that fence post before the concrete sets up, it's not going to set. So I want that implant to be well osseointegrated before I load it. Even in the anterior, if I'm placing an implant, if they need a provisional, it'll be a removable flipper so that there's not any pressure on the implant in the bone, no wiggle. All right, so my technician always puts this in the box with the restorations, just so I know that the lithium disilicate crowns or veneers have been primed, have been treated in the laboratory. Hello, this video is a small portion of a complete comprehensive video. If you'd like to see this complete comprehensive case and many other complete comprehensive cases, click on the link in the description below. Now, I'm seating this implant abutment and crown. I prefer screw retained implant abutments and crown. The reason for that is one of the biggest reasons for losing a root form implant is excess cement on a cemented crown. Now, if you have a screw retained crown, the micro gap between the crown and the abutment is under 8 microns, which is less than the thickness of the diameter of bacteria, and you don't have to worry about excess cement. So the fit is fantastic, and you don't have to worry about trying to remove subgingival excess cement. This is a good transfer. I did a review of the literature on how to prevent screw loosening in implants, because there was a year or two that I had a number of screws loosen in implants. And the feeling is from microtoma, from clenching. So night guards are very important, but also I'm going to show you how to torque it twice and also place this noble grip on the screw. So we place the noble grip on the screw that just really locks it in. Then I'm going to hand tighten it. Then I'm going to torque it. I'm going to check the contacts. And there's really no need to take a radiograph until you have torqued it to place. So I'm going to torque it to 35 Newton centimeters with this torque wrench. Then I'm going to let it sit for about 15 minutes and come back and torque it again to 35 Newton centimeters. Okay, that was the second torque of 35 Newton centimeters. So you place the noble grip on the screws, then torque it to 35 Newton centimeters, wait about 15 minutes, and then torque it again to 35 Newton centimeters. There's an article in the library of dentistrymasterclasses.com on how to do that. Now, I've added the noble grip to the screws. Knock on wood 100 times since I've been doing it like this, I've had no screw loosening of implant abutments and crowns. So it seems to work really, really well. We do a lot of implants. So I'm placing this plumber's tape in the orifice, and then I'm going to place primer adhesive. You don't have to shove it way down, just kind of pack it in there. Then primer, you want to cover up the screw because you don't want the primer adhesive or the filled resin to get on the screw. Just in case one day you had to retrieve that implant and remove it for any reason, say you did have a screw loosen, you'd be able to unscrew it, replace the screw, and screw it back to place again. So you don't want the primer adhesive or the filled resin, the composite, to get on the screw. So I cured the primer adhesive, and now you can either use flowable or highly filled. I'm using a little bit of both of them. Just a little bit of flowable on top of the plumber's tape, and then placing highly filled resin. This is a great instrument to adapt filled resin, this egg-shaped ball burnisher. Then I'm going to cure that for 60 seconds, then check the occlusion, adjust it. And what kind of occlusion do you want on this restoration? Well, if it's a bicuspid, I would like it to be just a tiny bit out of occlusion when the patient leaves the office. Otherwise, they're going to think they've got a crown that's high. So just barely, barely out of occlusion. Be sure there are no eccentric contacts unless it's an anterior tooth and the anterior guidance is on that tooth. So there's the final. That's the Dental Minute. These techniques work, and they work every time.
Are you ready to take your dentistry practice to the highest level possible? Of course you are! Subscribe right now to dentistrymasterclasses.com, where you will get Dr. Cutbirth's greatest work and best cases. Here's what you're going to get when you subscribe to dentistrymasterclasses.com. Incredible comprehensive cases not seen in Dental Minute videos. You will get an organized library of all the Dental Minute videos and Dentistry Masterclasses, comprehensive cases for study and reference, before and after photos of Dr. Cutbirth's fantastic restored cases. And all of this, I repeat, all of this is just $40 a month. This is something you cannot pass up. Subscribe right now to dentistrymasterclasses.com.